Hello, my name is Sean Swan, and today we're going to be talking about oral health for women in primary care. Going to look at problems that exist in primary care, oral cancer, oral infections, oral health in terms of pregnancy, and then methods that we can use to improve oral health in primary care. First off, one of the problems that exists in primary care is inadequate screening of our patients. This is very important and shouldn't be missed by primary care providers for prevention purposes. Um, Another issue is healthcare disparities. Um, Many people don't have insurance, they don't have a lot of money, so a lot of times this is the first time that the patient's being seen and could be properly screened for oral health rather than a dentist, etc. Next, in terms of oral cancer in women, this is very important for us to address in primary care as it's one of the highest causes of cancer-related deaths. Catching it earlier leads to easier treatment and better condition of the patient. Also, screening for oral cancer risk factors, tobacco, alcohol, sexual behavior. Um, Next, we'll talk about oral infections. Very common infection in our patients is periodontal disease and tooth decay. So it's important that we're adequately screening these patients for symptoms that's related to that, gum disease, gingivitis, etc. Also, in terms of oral health infections, it's important that we're screening for potential STDs, STIs, and any associated symptoms that the STI may present, anywhere from chlamydia, gonorrhea, syphilis, genital herpes, HPV, all are things that can manifest in our patients. So it's something we should be aware of. Next, we'll be talking about oral health and women during pregnancy. This is for the pregnant state in women. Significantly increases the risk of periodontal disease and tooth decay due to the transition in hormones, and it changes the flora of bacteria in the mother's mouth. But the pregnant state and the oral health in women has been known to cause problems with the pregnancy in terms of premature birth, etc. So this is a population group that should be looked at a little bit more closely. Lastly, ways we can improve oral health in women in the primary care setting. One of the things that we can do is add oral health screening to our assessment. Instead of the traditional HEENT, head, eyes, ears, nose, throat assessment, we can attempt to incorporate the O, or the HEENOT, head, ears, eyes, nose, oral cavity, and throat assessment and into our practice. Additionally, we can also educate our patients on self-care practices, make sure they're brushing, flossing, use of fluoride products, and making sure they're going to a dentist, making referrals to a dentist if need be. Also, dietary changes, and most importantly, the HPV vaccine. We need to make sure that our patients are receiving this vaccine for prevention there again, and obviously sexual health, good practices as far as barriers, etc. Thank you.